Jaleena Jessop. Dr. Jessop, how are you doing?
We're doing good. Everybody's hanging in there through this.
You're doing good. You're
Yeah.
surviving. How is your team? How is your dental office?
My dental office is doing good. I mean, we're not, of course, at the same capacity as we were a month ago, which is pretty crazy and pretty fast downturn for us that way. But I think spirits are up. We know the whole world's in this together. So we're just kind of working our way through it.
Yeah, I agree with you. There's a lot of change going on right now in dentistry. There's a lot of uncertainty, and we're just kind of living day by day, especially state by state. So we know a lot of you are from all around the world watching this, or at least all around our nation. So if you're watching, please drop an orange heart, show some love to Dr. J. So is your office currently closed all the way down, or what? How are you guys seeing patients right now?
We're still seeing emergency urgent patients. So if we get a call, we try to bundle them so it's less in and out of the office, and we go through the cleaning protocols, opening the doors, using the Lysol sprays, trying to just keep everything as clean air as possible. We take the temperatures, we do the hydrogen peroxide mouth rinse. We have more PPE on than we've ever had, before this with the N95s. It's a different world, but we're coping, and we're still happy to care for the patients that need us, during an emergency time. I think we need to remember we are healthcare providers, and I'm very proud of our profession, and I think everybody's doing the best they can to care for their patients out there right now.
Yeah, agreed. We have our medical doctors, and then we have our doctors in dentistry, and we're all doctors, and our whole goal is to just make people healthy.
Yeah, that's why we went into this. It's healthcare and caring for people. So this is not the time for us to turn our backs on them, and I don't think we are. But we are limiting how we take care of them during these times.
So you said you're seeing a lot of emergency patients, and Ultradent discounted a bunch of emergency products. How did you pick those products? Is it the products that you use day to day?
Mostly the products that we use day to day. We kind of filtered out things that are for preventive treatments with hygiene. We're trying to stick to restorative things, endo, those kind of items that the doctors in their practices really need right now. I think we just want to show our support out there to all of our colleagues and our customers, but our colleagues too. I mean, we started this business on my dad's, expertise as being a dentist, and we continue that. I work with dentists here in clinical affairs, and it's so important that as a business we continue, because we want to continue even for our own private practices, and to help our doctors support their practices and our hygienists support their practices.
Definitely. And health doesn't stop. Even though we have this pandemic going on and we have a different health crisis, dentistry is always going to be there. Although we think about all these sweets and sugars, we're always going to be a crucial part of the health industry.
I think there's a lot of stress out there right now. I'm seeing a lot of cracked teeth that I haven't seen in years and years. People are clenching, and they're carrying a lot of stress in their jaws when they're sleeping. And so I always say, like, the dentists are the bartenders of the health profession. You hear everybody's, stresses and concerns, and you get to know these people so well. I mean, they become like extended family. So
true.
when they come in, and, I've had several crack clear down into roots. So we've had to do extractions on things like that, but just taking the time to talk to them to see if you can alleviate any of their fears or concerns, and just let them know life will go on. So it's nice to be able to still be there for those who need you.
Yeah, definitely. I know that I'm one of those stress people. One night I didn't wear my night guard, and I woke up and I was like, "Dang, girl, you're
reminded real quick, huh?"
Real fast. All it took was one night, and I was like, "Oh, I shouldn't have done that." And I know that, but I did it anyways.
Yeah. Sometimes you just get tired and fall asleep. I wear one too. I am also someone who carries a lot of stress in her jaw. So I get it.
So we talked a little bit about PPE with your team and you, and how you kind of switched that up.
Yeah.
What are you thinking about PPE and dentistry in the future?
I place implants in my office, and we usually gown up more for surgeries, extractions, bone grafts, things like that. And today it's like you gown up like everything's a surgery. So with our N95s, because they're so limited, we throw one of these puppies over the top of it so that we can extend, the lives of our N95s. So we throw away this one and we keep the N95s a little bit longer. But the hydrogen peroxide rinse, that's huge. We do a 2% hydrogen peroxide rinse for 1 minute, have them swish before we work on them. The goggles, the glasses are tight fitting, of course, for assistance. With us, it's a little hard with loops, trying to get the focus down through the magnification with the N95 mask. So, you squish it in a little bit tighter. We look ridiculous once all this comes off. We've got about 1 million imprints on our faces, but it's good. It's something that, everybody's very willing to participate in. I will say, patients come in and we say, we can't take you back. We won't even let the lab person come in. We won't let delivery person come in without taking temperatures before they step in around anybody. But everybody's pretty on board. I think it's a pleasant thing to see everybody just kind of understand this is something we all have to do together to get past this. So I've been very impressed with patients and just delivery people even coming into our office. So it's makes me proud to be an American right now.
I'm so happy to hear that. And I'm sure that it makes you feel safer and makes your patients feel safer knowing that you're taking these extra steps to protect them and also your team members, because we have to remember about our team members because they are also what help us going and they feel safer too.
Yeah, no, it's true. I mean, they look to us to make sure that we've got their back. We're the ones who have to pay to make sure that they have what they need. And that's number one. If they don't feel safe, then you've lost the whole integrity of your office.
Yeah.
Somebody just asked who is who.
Who is who?
I'm Dr. J.
And I'm Hartley. Dr.
There
J
you go.
is the Vice President of Clinical Affairs. That was Alexander. And then we want to say hello to Chitra Durgam. And then you have a fan on there too. She has a fan name.
Hey, thank you. Fellow Jessop.
Fellow Jessop.
That would make my husband very proud for you to say that, by the way.
Very name. That makes sense.
Yeah.
I'm not sure if people, because you are married to Neil, know that you are the daughter of Dr. Fisher.
Yes.
I think a lot of people do, but maybe not some people that are watching right now.
Yeah, this has been kind of my whole life, so I'm proud of it.
And it's a good passion to have. We love teeth. They're perfect.
It is. It's one of those things that everybody just think it's just teeth. It's confidence, it's health, it's what makes people smile, makes them want to show that. I think there's a difference between a closed mouth smile and a true genuine laughter smile.
So true.
And it's kind of nice to be part of that.
Yep. And mental health too. Like being able to share a real genuine smile. I had a friend who was like, I don't know why you went into dental hygiene, because you could just pull all of your teeth and have dentures and be totally fine. And I was like, the day you get dentures, I want you to eat a steak and a salad and tell me how that goes. Like, if that's still a great experience, okay, but
no, it's not the same thing. No. It's nice to have it as an option, but it's not the same thing.
Exactly. Well, it looks like we aren't having any questions. If anybody has any questions, please drop them down in the comments and we will be glad to answer them. It looks like Sophia says that she's a big fan of you.
Ah, Sophia. Mwah. Love to you in Chicago.
Oh, way cool. Chicago. Do you have any inspirational words for our doctors in dentistry right now?
I was sitting with a couple of my colleagues just here in my office last night. We're still so busy in clinical affairs right now. Ultradent, even though things are in a downturn because your offices and my office are in a downturn, we're still working really, really hard to make sure that we're developing, that we're getting through regulations that are required now in Europe. So we're busy. We're really, really busy. So if we're not busy in our offices, we're busy here at the Ultradent headquarters office. And we were just talking last night about we're just all in this together. And they even said, if you need to give us a pay cut, and I'm, struggling because I know they're not in their offices. And they said, if Ultradent doesn't continue, we can't continue the way we practice. And that
hit.
I will share something. This is like my mom is so funny and so cute. So she sends me these little memes about every day. Some of them I can't share with you, just so you know, but she's so cute. But there's one she sent to me the other day that is just so true. And it says, crisis doesn't create character, it reveals it.
That is so true.
It's true. And I won't show you the one today. It's sent some good ones. Let's just put it that way.
It looks like we have a question from Dr. Chitra. Any suggestions for Ultradent products to sell to patients when offices open?
Any suggestions for Ultradent products to sell to patients when offices are open? I think we should move right along with our whitening. I'll tell you right now, when I have emergency patients come in, I told you I do a hydrogen peroxide rinse with my patients. I will still send them home with the whitening. That hydrogen peroxide will kill the bacteria and the viruses. It's antimicrobial in your mouth. Wow. So I will still send them home with that if they feel like, like one person I had has allergies and she's sneezing constantly. So, I just said, what, pop one of these in every once in a while, especially if you're going to be around other people, and just try to cut down on that microbial load. The toothpastes are always good, especially the sensitivity relief ones. Like I said, people are just they're intense right now. I had a patient come in, and sometimes depending upon, their healthcare, I'll have them brush a little bit first too, even beyond the rinsing. Yeah. And they're just heavy-handed. It's like everything's just gotten intense. So, I said, here, take this anti-sensitive. You're gonna need this, So yeah. Just some of those things that are just some day-to-day hair products are really nice to have.
Now, when you say whitening, do you usually say our PF, or do you do our Go trays?
The Go trays, especially right now. This is not the time for me making custom trays, in my opinion. That's one more visit too. When we're supposed to be cutting down on the number of visits, that kind of goes against what the ADA and CDC recommend.
Yeah. Looks like Sophia says, do you think dentists will have to work in a sterile environment like the OR in the future to protect themselves and patients from contamination risks?
I think we're going to do a little bit of pendulum swinging, to be honest. I think it would be pretty unrealistic for that to be an expectation come day one when we can open our offices again. Yeah. I think there's going to be air filtration systems that will be required that will probably be closer down to where the patient's head is or their feet, so it pulls it away from staff. Mm-hmm. I think there's going to be more PPE. Right now, I'll tell you, from being in my office and friends' offices and then going into my medical doctor's office, we're so much more on top of cleaning and wiping in between patients. We've done a really good job in this industry of making sure that everything is wiped and cleaned. I've gone into offices where I watch someone walk in and 2 seconds later they bring someone in, they just rip the paper off the bed and that's it. So I think dentists are actually keeping up on this and ahead of the game in this way than most other type of medical offices are outside of the hospitals.
I hope that answers your question, Sophia. I agree with you.
And if it doesn't, just call me. We'll chat about it over a glass of wine or something.
There you go. A virtual glass of wine, right? Yours is
exactly.
But your meeting is virtual. That's what we're meeting.
No, it is a really interesting time. Like our family, you know how big our family is, and we had a Zoom family dinner.
You did.
And because there's so many of us in healthcare, we can't be around my parents. We can't, but you get that many on a Zoom call and that's chaos. So I think we've learned our lesson.
Yeah, it's good chaos. I come from a large family too, and I haven't even crossed that yet. I was like, this is going to be too hard. There's a lot of people chiming in at one time, side conversations.
Oh goodness. It's an interesting time.
It is an interesting time, but it's a great time in dentistry for us to kind of be able to pave the way of what our future is going to look like.
Yeah,
And
absolutely.
yeah, and at least we know that we're all in this together. It's not going to be one person changes everything. We all have to be that person that says, hey, okay, what do we all think? Let's collaborate. Let's figure out what the best case scenario is and move forward.
I will tell you, after having gone through the recession in 2007 as well, I think we're going to have some very similar kinds of treatment outcomes for a while, like we did in 2007. 2007, before there was a lot of, PROS, indirect restorations, and I think we're going to be seeing a lot of direct restorations being placed again, cutting down on lab costs and that after we have a lot of catch up to do for our bank accounts and our private offices. So I think we'll be seeing a lot of large bonded composites and that again, just to keep bills down, trying to still take care of patients. And I think this is an opportunity for us to really use our bonding skills and prove to ourselves what we can do. And I think your patients will be on your side doing that. I've talked with Karen in our CE department and Jason, and I think this is the time we need to help everybody refresh how to get a good bond and how to do that. So if those are things that you'd be interested in, please ping us in some way and let us know, because we want to take this time to help you guys where we can so that when your doors are open again, you can get in and get running.
Yeah, and actually a good tip that I heard is when your doors do open again, to kind of help yourself out, do your bigger cases right now. Those are the most important anyways. I'm not going to do like a duo before doing a crown. When I say me, obviously you. But that's going to be a more important and a bigger case for you to also help you once you start up again.
Yeah. Got a question here asking about the staff being afraid to return. I think all of us are a little concerned about that. I think we're concerned in several ways. We're concerned that they won't want to return because maybe the unemployment's pretty good right now with some of these checks coming, or that they're afraid because of what they're going to contract. And those are all true. I mean, for the most part, we went to school, got a degree. Hygienists went to school, got a degree. Dental assistants, some get a degree and some don't. And so, they some of them have maybe not the 12-year-old girl or boy, passion about I'm going to be a dentist one day, so they don't have that same drive for it. Some do. I've got a couple that are like, whatever is. But I also have a couple that are really scared about it. So, I think all we can do is sit down, educate them as much as we can. I think them knowing we're doing every precaution possible to do that. Ones that have higher fear than others, I keep, more to the back and sterilization. And the ones that feel a little bit more confident about being in with patients, I'm kind of juggling depending upon where their emotions are right now.
Yeah, and your team looks at you as a leader. So being authentic and telling them the truth that if you're scared, let them know, we're scared too, but we're also healthcare providers. We need to make sure these patients are healthy. If you do leave that MO for too long, it's going to turn into a crown. You can't leave these patients behind because they also have this disease that needs to be fixed and healed.
Yeah, this is not a time to turn our patients into dental cripples. We need to just make sure that we're getting in doing something that's solid, like the large bonded composite fillings, the pulp caps if it needs to happen, the endo if it needs to happen. But yeah, I'm really trying hard not to temporize too much. I would rather do a large bonded something than temporize anything, because none of us know how long this is going to go on. With just now the stay home laws that were just, Salt Lake County, said till middle of April. Well, they just extended it till May. So, we don't know how long this is going to occur. And with people stressed and clenching more, I think it's just in our best interest to try to do something, bonded cores, whatever, until we can get back in our offices.
I agree.
Sorry, my dear Jennifer, I understand. I understand the stress and the concerns. I wish there were better answers. But one thing I can say, COVID is not a hard virus to kill. It's a lipid membrane. Soap and water will kill it. Just the basic things that CDC keeps saying about washing your hands, not touching your face. Things like that make all the difference in the world. I've had my staff make sure they strip off their scrubs and that. Those go in the washer the second they get home, so they're not transporting things back and forth. But simple, even washing your face with soap, wearing a head cover over your hair if you want, so you're not touching it inadvertently. Just things like that will keep it under control.
Agreed. This is a comment that we just got from David. Hi, David. Looks like he's from the Republic of Georgia. That's cool.
Mm-hmm. Hey, I've got a friend from Republic of Georgia, Dr. Lela Decano down in Beverly Hills. Yeah.
David, do you know that person?
She's from Tbilisi too. Interesting.
Wow.
Well, hi to your team.
And hello, Melanie, as well. And we always appreciate you. All right, Dr. J, looks like we don't have any other questions. Any last words for everybody who's watching?
Just hang in there, guys. We're all in this together, and let us know how we can support you as Ultradent, and let me know how I can support you as a colleague. So good luck to you and your teams.
Thanks, everybody. And as always, if you have any other questions, please drop them down in the comments. And remember, if you did love this conversation, also drop that orange heart. Thanks so much and have a great rest of your day.